Welcome to the Medical Marijuana and Wellness webinar series. Tonight's topic will be dosing with medical marijuana. A very important topic, something that is near and dear to everybody's heart is using medical cannabis, and something that not a lot of people have got a lot of information on. So hopefully tonight will be helpful to you. The objective that we have with this webinar is very simple. Our goal is if we can get one person tonight to be able to get their life back, be able to use medical cannabis and restore their life to some sort of normalcy, then we think we've been successful, and that's what we're trying to do. This seminar series is designed to really not only provide information, but also answer your questions. So please feel free to answer your questions. And on that note, you'll see a little bubble that's down here, a little Q&A button that's right down in here. It looks like two little bubbles. It says Q&A. If you could put your questions in there, we'd really appreciate it. We'll be monitoring that. There is a bubble over here that says chat. Some people put questions in chat, and we'll try to answer the questions in chat, but we pay more attention to the Q&A button than we do the chat button. Tonight's topic is very important, and it's something that's near and dear, again, to everybody's heart. I have a couple of people that are going to help me of this important topic, and I'd like to introduce them. First of all, I'd like to introduce Turner Davis. Turner is with Medical Marijuana Treatment Clinics of Florida. And Turner, tell us a little bit about you and what you do.
Hey, Mark, thanks. Yeah, I'm, like Mark said, my name's Turner Davis. I work with Medical Marijuana Treatment Clinics of Florida. I'm a pharmacist by trade. I've been a pharmacist since 1998. I've been working in the medical cannabis industry since 2012. So really was able to get in the very beginning of the Florida medical marijuana market and really learn, start to learn from the ground up as the dispensaries in Florida developed, as the medical program developed. And have been fortunate enough to be able to make a career out of specializing in medical cannabis, and really, acting as a go-between and an educator between the physicians and the patients to help them understand how best to use medication and what will work best for them. So yeah, I always enjoy doing these dosing discussions. I think it's really something that's not as intuitive as a lot of people may think. It's not as easy as going in and taking 1 5 milligram tablet every day, like a lot of our prescription medications are. So I think, the goal at the end of the discussion today is to just have a better idea of how to maximize the benefit of using marijuana medically to treat whatever condition, a patient may be seeking relief from. So.
Turner, you're being very humble. You were practicing pharmacist for a number of years and have a degree in pharmacy, right?
Yep, absolutely. Since '98. Was worked several different fields: pharmacy, long-term care, infusion, as well as retail pharmacy for almost 15 years before starting to focus on medical marijuana. So yeah, seen all sides of it. So definitely the benefit patients that I've seen patients have using marijuana over what I saw in the pharmacy world with opioids and those sorts of things, the never-ending merry-go-round some patients unfortunately get stuck on. It is nice to be able to work on the side and see an alternative therapy really help people out without a lot of those negative side effects. So
yeah, and you helped build MMTC, which has got 25 clinics here in Florida, but more importantly, you've helped literally thousands of patients over the last 4 to 5 years.
Yeah, no, it's, when I first started working in medical marijuana, as the laws developed, we weren't sure what side, we would be best served to work on, whether it would be the product side or the patient physician relationship side. And as the rules developed, and we saw our role more in the patient physician education side, providing an avenue, an easy way for patients to get their medical ID cards, as well as helping doctors, to understand how to educate their patients on cannabis, because we're all learning as we go on this. Doctors, I didn't have a course in medical marijuana in pharmacy school. Doctors don't have a course in medical marijuana, in medical school until very recently, if at all. So a lot of this we've had to learn as we go, and being a resource to both professionals and patients is really, where we sort of landed there. So,
and I think you've done a great job. I've had the pleasure of working with you for the last almost 5 years, and it's been great to see the number of people that you have helped get their life back.
Absolutely.
So, but I'd also like to introduce an important player, Nick. is with Move. Nick, tell us a little bit about yourself, what you do, and some of your background.
Absolutely. Thank you so much, Mark. And at first, I'd like to give a special thanks to this community here between Mark and Turner, so much that you guys do for Florida as a whole and for the medical program, being able to provide this education and being a part of this. I'm just so grateful to be on a panel with you all today. I actually come from the marketing world. I've been a patient for the last 4 years. So I've seen this medical program go from the ground up. And I'm so grateful to be with a team that puts so much effort and dedication into their precise medication. And when it comes down to it, we have some amazing opportunities that Move to find relief via alternative dosing. And it all starts with finding that right sweet spot. So I'm grateful to be a part of this panel today to really kind of uncover some of those myths and really discover what's going to be, which route we want to take and where we want to start. So thank you so much, Mark.
Oh, no, thank you very much. So let's dive right in. We've got some tremendous material to be able to take a look at. What I'd like to do is share a few slides. First of all, I want to, a little housekeeping. This is the Medical Marijuana and Wellness webinar series. It's part of a webinar series. You can see down here, we're doing dosing today. Next week will be pain management. We're doing Delta-8, topicals, anxiety and stress, and ketamine over the next couple of weeks. So we address a number of different topics, and obviously next quarter we'll have another series of webinars. I do want to point out that tonight's webinar will be is being live streamed on Facebook. And what you will get after this webinar is you'll get an email from us. It'll probably come late Friday afternoon, and it'll be a copy of the video, which will be a link to YouTube, a copy of the presentation, all the resource notes that are out there, discounts, which we talk about during this webinar from Move and other places. And so we have a whole place that's the comprehensive summary of this particular webinar. I know a lot of people, this webinar is like drinking water out of a fire hose. There's a lot of information. So you'll be able to actually go back and review the slides and review the information afterwards if you kind of miss something. So let's dive right in. One of the things that I found in working in medical cannabis is, as Nick was mentioning, finding the right dosing is really important. And over the years, I've got a lot of feedback on dosing. We've had comments like, it didn't work, so I quit. I felt high, so it was an uncomfortable experience. It works, but not as well as I hoped. I can't just smoke a joint, or why can't I just smoke a joint to get relief? And I don't know where to go for help for dosing. So those are a lot of the questions that people bring up. And I put this slide up first because we're going to review this at the end. We're going to answer almost all of these questions as we go along. And we'll be able to make sure that we address all of these things. I think to start out with dosing, one of the most important things is that cannabis, as Turner was mentioning, this isn't a program where you take 2 pills and you call me in the morning. The objective is to find your sweet spot. Every person's body is different. And I tend to make an analogy between cannabis and alcohol. We all know that alcohol affects every person's body differently. Your metabolism is differently. I have friends who will have 1 drink and they're done for the night. I have other friends that will drink the whole bottle and they're just getting started. And cannabis is very much the same way. It really has to be something where the sweet spot for you is going to be unique for you. And the question is how to find it. And we're going to talk about that tonight. It's how do you find your sweet spot? Because once you find your sweet spot, trust me, it's something that really will help you go forward and help you get your life back. I have 7 herniated discs in my neck from a automobile accident. That is not any fun. And I've been on medical cannabis now for almost 4.5 years. And I am able to lead a fairly normal life, able to exercise, do a lot of different activities. And that's because I did find my sweet spot. So it's something that once you find it, it's there and it does give you your life back. And that's what we're going to really talk about tonight. And it has to do with your tolerance to both THC and CBD, which terpenes that you want to use, and what dosing forms that you're comfortable with. So we're going to be talking about a lot of that today. So rather than me just chatting about the generalities of this, let me turn this over to Turner. Turner, why don't you take it away and tell us a little bit about the endocannabinoid system?
Yeah, that's great. If it's all right, I'll go ahead and share my screen just so I can kind of keep track of it here. Let's see. Let's see. Yep. So yeah, Marc gave us a great introduction there. So, as we talk about, the foundation of understanding medical cannabis dosing, it's really important for us to understand A part of the body, a system of the body called the endocannabinoid system. Now, this system of the body is a regulatory system that was really discovered back in the early 70s by a researcher out of Israel named Dr. Raphael Mechoulam. But it is a system of the body that, again, me as a pharmacist, physicians going to medical school, we didn't learn a lot about, because honestly, at the time, there was really no medication or no way to affect the endocannabinoid system. And we didn't really understand a lot of the role it played in a lot of disease states and a lot of conditions and symptoms patients may suffer, especially as a result of aging or as a result of chronic illness and those sorts of things. But the endocannabinoid system overall is a system of the body that regulates things like mood and sleep, inflammation in the body. And it's a very widespread system in the body. It plays a very important role in keeping our body in balance. And it is really surprising. The more we learn about the endocannabinoid system and the important roles it plays in the body, it's surprising that we don't really focus on it more from a therapeutic standpoint. But that's beginning to change with the more acceptance of cannabis as medicine, with more states offering cannabis as a legal product, more patients being able to take advantage of that. There's more research being done now, and the role and the importance of the endocannabinoid system plays in the body is really becoming more and more into focus. But when we talk about,
it didn't become a focus really until the 80s and 90s, when Dr. Raphael Mechoulam was looking at medical cannabis, or looking at general. It was always there, but it wasn't something that the medical community focused on.
Exactly. So, when we talk about the endocannabinoid system as the way it works with us ordinarily, naturally, it affects all those systems of the body. If it's not working properly, then we start to get symptoms, right? So if the endocannabinoid system, for example, affects inflammation, and all of a sudden it's not working as well, the inflammation increases in our body. Or if a well-functioning endocannabinoid system helps us sleep, if it's not functioning well, then all of a sudden our sleep patterns may suffer, our ability to get a good night's sleep may suffer. So just like we would supplement any other symptom or any other part of the system of the body that's not functioning correctly with an outside supplement, we can supplement the endocannabinoid system with medical cannabis. Think of calcium deficiency. What do? We take calcium, or we drink, the doctor tells us to drink more milk to get more calcium into our body. It's really the same concept here. We're supplementing our natural endocannabinoid system with an outside supplement. And in this case, that outside supplement is medical cannabis. There's two parts of the endocannabinoid system that really we focus on. There are molecules in the body on cells called receptors. And, I don't want to get too far into this, but basically what receptors are proteins on cells that interact with either chemicals in the body or outside chemicals like drugs and medications to cause an effect in the body. So naturally, our endocannabinoid system uses these receptors called Cb1 and Cb2 receptors. Cb1 receptors are present in the nervous system. So when we talk about things like sleep and mood, appetite, those sorts of things, those are all nervous system functions. So these Cb1 receptors play a big role in that. And THC is the part of the medical cannabis plant. This is one of the chemicals that really affects the Cb1 receptors really strongly. So when we talk about, it makes sense if the Cb1 receptors are in the nervous system, that we know the THC is the part that causes the intoxicating effects of cannabis, or the high, or we hear about it, marijuana gives us the munchies, right? Well, again, this is not always true, but that's a very popular sort of, cliche that we hear a lot. But that is because of the stimulation of these Cb1 receptors in the body. CBD, we hear a lot about. It actually sort of affects the endocannabinoid system overall. It doesn't directly interact with either one of the receptors, but it supports other things. And there are other endocannabinoid systems in medical cannabis, or cannabinoids rather, in medical cannabis that interact with the endocannabinoid system. CBN is one of these. affects Cb2 receptors. Cb2 receptors are present in the peripheral organs and in the immune system. So when we talk about things like inflammation and those sorts of things, Cb2 receptors play a very important role in that. So, but really what we learned from this is that you really using all of these cannabinoids that are present in the cannabis plant, THC, CBD, CBN, all of these things. We want to use all these together to engage the endocannabinoid system as much as we can with a single product. That's the advantage of medical cannabis over some of the other prescription medications that we use are usually very targeted. For example, they only target one receptor in the body or one part of one receptor in the body for a very specific effect. Now, the good thing about being specific like that is that it does minimize side effects, but it doesn't give you as much of an overall effect, a holistic effect, as a product that would stimulate the entire system. And medical cannabis is unique that way in the fact that it really engages the entire endocannabinoid system when you use all of these together. And that's called, they actually have a name for that. It's called the entourage effect. So we're using all of these different chemicals in the medical cannabis plant to really stimulate completely the endocannabinoid system to get the best result.
Really, Turner, the endocannabinoid system is how your body really not only regulates itself, but it's also how your body heals itself.
It does play an important role in the healing process and the inflammation process, all those sorts of things. Yeah, absolutely. It really, you can kind of look at it, I compare it a lot to like the endocrine system, with insulin. Insulin does a lot of different things in your body, from blood sugar to, to blood vessels, to all these things. And you really have to keep that in balance to keep your body in balance. Or thyroid is another one. Thyroid does a lot of different things in your body as far as the regulatory system. The endocannabinoid system is very similar. It does a lot of different things in the body, and it's important to keep it healthy. And if it's not healthy and it's not functioning well, then it's important to supplement it to minimize the symptoms that we may experience there. So this is just another graphic to sort of demonstrate the different ways that we can stimulate the endocannabinoid system. Of course, our brain-derived endocannabinoids, the part our body naturally makes to take advantage of this system, this endocannabinoid system. We can also supplement that with certain foods, omega-3s, omega-6 fatty acids. The actual chemical in the brain that's the neurotransmitter that stimulates these are called anandamide. There's another one called 2-AG that are made by the brain to naturally stimulate these. But again, as we age or as we're chronically ill, the brain may not function as well, may not make enough of those neurotransmitters. We can supplement with plant-derived endocannabinoid or plant-derived cannabinoids like THC, CBD, CBN. There are some synthetic cannabinoids on the market. Just interestingly enough, we hear a lot of debate about whether medical marijuana or marijuana can be used as medicine, or does it really have a therapeutic effect? And there's actually been synthetic products on the market that mimic the effect of certain parts of the cannabis plant for a lot of years. Marinol is one of these. It's a synthetic THC. It's been around since the early 80s. And they use this for chemotherapy patients for nausea and for appetite stimulation, which again shows the important role. Obviously, if they know that that stimulating these receptors causes these positive effects, they know there's a medicinal benefit there. But unfortunately, with this particular drug, it is synthetic, and it only affects, again, it's THC only, so it only affects the Cb1 receptor, which doesn't give you the best effect there. There's a lot of side effects when you really only target that one receptor as opposed to the endocannabinoid system as a whole. So it's never really gotten that popular as a therapy. A lot of people have poor reactions to it. Their mood suffers, those sorts of things. There was actually a trial in the early 2000s of a drug that really focused on blocking Cb1 receptors. They were, when we go back to talking about the munchies and appetite stimulation, they were looking at a drug for weight loss that would block the Cb1 receptor. A couple of drug companies where it actually got to phase 3 trials. So again, that shows the important role that plays in the body. But again, it targeted and blocked just the Cb1 receptors. And when they did that, what they found was people suffered from severe depression. Yes, it reduced their appetite, but it also reduced their quality of life and mood. So that in itself shows you the important role this receptor plays in the body and the multiple effects that it has, from appetite stimulation to mood and those sorts of things. So that's why those drugs aren't on the market today, because they had such a negative effect on mood and depression that they weren't able to come to market.
And you're making a really good point. What they were trying to do is take a natural plant that works perfectly without a problem, trying to obviously synthesize it for a particular reason, and really had difficulties getting that right.
Yeah, no, I mean, again, that's really the way that the commercial medical market works, is they really target one specific receptor or one specific part of a cell to attack with a drug. And, you know, a lot of times you get a lot of good benefit with that, but in something like this, where the effect is so broad of the receptor or the system in the body, they really couldn't target it because it has so many other effects. And that's why, again, when we talk about medical marijuana and supplementing the entire endocannabinoid system, is why that's important, and why that works better than just targeting one receptor or another. Again, this is just another way to look at what we're discussing there. You know, if we look at the endocannabinoid system as the road we want to travel, keeping the highway open, the paths open, good communication amongst our body. We look at our brain as the driver, the anandamide really stimulating the endocannabinoid system naturally. And we can look at you know, the cannabinoids as a passenger or a supplement to help those natural help the driver along to really get to where they want to go. And we can look at there's another aspect of medical cannabis called terpenes, we'll talk about here, that really sort of, if we look at cannabinoids, the CBD and THC of the medical cannabis plant is sort of the engine of the car. We can look at terpenes as a steering wheel. Terpenes sort of really refine the effect of a medical marijuana product. For example, that maybe terpenes can make a product more relaxing or more stimulating. It can be more targeted towards inflammation or towards other things based on the terpene profile of the particular product. We'll talk a little bit more about that later. Just wanted to touch on that for a second here. But the big takeaway, again, you know, using these cannabinoids from the cannabis plant to stimulate the endocannabinoid system in a holistic way, really affecting all, you know, which affects a lot of different parts of the body, that keeps our body in balance. And that's really the goal that we want to achieve, is stimulating this, getting the results we want, and minimizing the side effects. So that's
important to point out that cannabis has been this, you know, and cannabis has 450 different medical properties to it.
Exactly. You know, when we talk about terpenes, there's a lot. There's of the different cannabinoids. There can be, you know, upwards of 100 different cannabinoids in a single cannabis strain or plant. So really, you know, the refinement that you know, either genetics of the plant or the refinement that the dispensaries like Move take to refine a product to get the effect we want, the effect that we're seeking, is really the best way. When we talk about using cannabis medically, it really helps to use those sorts of products that are targeted, that we understand the ratios of CBD to THC in a product, and that really comes from being able to work and manipulate those products to get the sorts of ratios of those cannabinoids that we want to best stimulate. So this is just a slide, the cannabis plant here. I'm sure we've all seen photos here, but for those of you who are familiar, these little crystals on the plants, these little
trichomes are really the deal.
Yeah, are called trichomes, and that's where all that cannabis oil, all those cannabinoids really live. So all of those plants we see, this is what we're at. This is what they're after right here. These little trichomes on the plants. So just something interesting there for those who may not be familiar with that part of it. Before we get too much further into the terpene piece of it and the other the dosing aspects, just wanted to clarify really quickly. We get a lot of questions about, you know, what's the difference between hemp versus marijuana plants. You know, is when we talk about CBD, you know, we get confused a lot of times about hemp derived, or does it come from cannabis plants? Really, you know, and
Now, Turner, what we ought to do is we ought to let Nick tell us a little bit about this.
Yeah, no, sure. No, that's a good point. Yeah, Nick, you'd probably be more.
No. I was going to follow up with you there, Turner, at the end, because you're absolutely going down the right thing. Not all CBD is created equal, and CBD coming from hemp needs to be undersourced from a very sustainable location. At the end of the day, you really need to know where you're buying these products from, because there's variations in the way it's grown. Here at Move, we absolutely do produce CBD, and it comes from marijuana. we actually remediate the THC from the plant and leave actually just the CBD so that you actually have the full actual true to plant extract. But when it comes down to it here on the market, there's hemp, which you're going to be able to find with 0.3% or less THC content. And then marijuana, which is obviously going to be a lot higher than that. But that's going to produce a psychotropic and euphoric effect. But whereas that's going to be for the more medicinal side, the hemp we usually see in the more textile, more commercial side. They're using things to make hygiene products, paper. That's non-medicinal uses. So while it might be legal throughout the 50 states, the actual hot THC or greater than 0.3% marijuana is only legal here in Florida, and then the other 33 states where it's recreational or legal. So, and what were you saying there, Turner, before Marc jumped in?
Oh no, it just you know, from an actual plant standpoint, you know, the interesting thing, you know, hemp and marijuana are both the same in the same genus of plant. They're the same. You know, hemp, marijuana come from the same plant family. The difference is, again, like you just mentioned, the amount of THC content in the marijuana and the other cannabinoids are in much higher percentages in the marijuana plant than in the hemp plant. You know, for example, CBD derived hemp, you have to extract a lot more hemp to get that CBD than you do from marijuana, just because of the amount of cannabinoids are much higher in the marijuana plant than the hemp plant. So,
and I think I've read in some articles where hemp-based CBD has 82 medical properties, where marijuana-based CBD has 108 medical properties. So there's clearly there's more bang for the buck in the marijuana side than the hemp side when it comes to CBD.
Yeah, no, absolutely. Yeah, no, there's definitely more, you know, just more potency in the marijuana plant than the hemp plant. So, but yeah, that's just something to touch on there, and I think they covered that well. But I just wanted to point that out as we move forward here. You know, I don't know. You know, we start throwing around these terms a lot too. We want to make sure everybody understands. We mentioned before, but just to clarify again. When you'll hear us say these a lot, THC, CBD, these are two of the most prominent cannabinoids in the cannabis plant. These are two, what we really, when we talk about potency of the cannabis plant, this is typically what we're talking about here. How much THC is in a plant, or how much, you know, or the ratio, how much THC to CBD is in a plant. So again, the THC is the psychoactive or the intoxicating piece of the cannabis plant. Also has a lot of medicinal effects. You know, a lot of times you'll hear the CBD called the medical part of cannabis. That's not really accurate, because THC has a lot of medical properties too. You know, again, we talk about mood elevation, we talk about sleep, appetite stimulation, nausea control, pain control. So really, again, going back to that entourage effect theory, what we really want to do is use both of these together to get the best medicinal benefit that we can from the plant. This is a wheel that we've used for a lot of years, just to sort of demonstrate, you know, all the different medical properties of some of these different cannabinoids within the cannabis plant. And again, when we talk about the entourage effect, using them together, we can see, you know, for example, as a pain control medication, if we can use something with CBD, which reduces inflammation, and THC, which reduces pain signals, that's a really good, that becomes a really good pain medication at that point.
Yeah, it's kind of like one and one is three.
Yeah, exactly. Yeah, I mean, there's nothing on the market today that both reduces inflammation and reduces pain signals. When we talk about, for example, opiates, you know, that's one of the big problems with chronic opiate use for pain medications, as well as the addictive properties, of course. But you know, opiates don't do anything for inflammation. And a lot of pain, you know, when we think about back pain or neck pain or knee pain, all of those things have really big inflammatory components, and inflammation causes a lot of the pain that results from those chronic conditions. So it's really important to reduce that inflammation to get the best pain control. And that's what we see with the cannabis plant, is being able to reduce that inflammation in a safe way, with lower side effects than you know, than taking ibuprofen or prednisone or something like that for years and years, which we know causes chronic use, causes a lot of negative side effects with a lot of those anti-inflammatory medications. So again, it just provides a good alternative in one package to do, you know, to provide a lot of relief there. So,
and I want to point out, this is kind of a summary slide. If you take a look at the number of strains or a number of components, the cannabinoids that are in cannabis, I think they've listed over 200 of them now. Not all of them have been studied. A lot of them have been found. these are kind of the main ones. And we're just kind of touching on the highlights, but there's a lot more to medical cannabis than just these particular components right here.
Oh no, absolutely. Yeah, we could spend a lot of time, probably a 10-part series, on just the different cannabinoids in the plant. But just as a general takeaway, just understanding that using the cannabis plant as a whole is really the best. That entourage effect is the best way to attack it, to get the biggest effect from the product that you can. We talked about terpenes earlier. Again, just wanted to mention that again. These terpenes are volatile chemicals, and they're present in a lot of different plants. When we think about the way flowers smell or the way fruit smells or taste, a lot of that is due to terpene contents in the different plants. And you can see the names of these terpenes. They were identified: limonene from lemons, pinene from pine trees, myrcene, those sorts of, it comes from a lot of different fruits like mangoes and things. And a lot of these, like we mentioned before, they have their own medical benefits. If you think about aromatherapy, for example, that is based on terpene science. The medical benefits, the anxiety relief, the sedation, the help sleeping from aromatherapy all comes from these terpenes. But the cannabis plant has natural terpenes as well. And that really differentiates when we think about, especially the original way of thinking about different types of cannabis, the strains, right? We have all the different strain names. One of the biggest differences between those strains is the amount of these terpenes that are in them. For example, myrcene, when we talk about indica versus sativa strains of cannabis, myrcene is really sort of the thing that differentiates an indica versus a sativa strain. The higher the amount of myrcene, the more relaxing the strain is. If it has more than 0.5% of myrcene in it, then it's usually considered to be an indica strain. Less than 0.5%, usually a sativa strain, because again, we know the indicas are more sedating, and myrcene is what causes that effect. So really, I point this out just to be aware when you're going in to select a product, a medical cannabis product, and make that decision. It's important to look at the terpene profile that's usually present, with a product. When you're making that effect, for example, if you're wanting something to, if you wanting to be able to function well throughout the day, but help, have something help your pain, something with a little lower myrcene level is probably what you want, because you don't want to be drowsy all day. Whereas if you want something to help you sleep, something with more myrcene in it may be a good idea, because it could help you sleep. Or more linalool is also sedating. This is your lavender oil that you think about that may be relaxing. So again, just something to think about, something to pay attention to, when you're making a selection on a product.
Yeah, and I want to point out, Nick, maybe you can comment on this. I know a lot of people, when they walk into a dispensary, they'll see the comments about the different strains. How do you know what terpenes are in the products? Can I ask the bud tender?
Absolutely. I was just about to make a comment there. It's all about communication. And just like when we said what Turner was saying there, really identifying what your needs are, whether it's for drowsiness, energetic, whether you're trying to identify a certain area of pain, whether it's inflammation. It's all about telling the med tender which direction you're trying to go with your cannabis journey, and them actually being able to identify the terpene profile that's best for you. And they really reach for the same chart that we're looking for right now, because it all starts with these standard terpenes here. And from here, it gets a little bit more complex. But as we get down, it's all about dialing in your best product. And when we start the journey with linalool for those evening times, and the myrcene for the evening time, and we reach for the limonene for the daytime for more energetic, you really see the difference. But I think the most important thing is finding a product that has the higher terpene percentage. And we know that by the COAs. And every single dispensary in the state of Florida has to have a certificate of approval for their product. And that's going to tell them exactly what percentage of the terpene is in there.
Yeah.
And when
now,
I'm picking flower,
these six terpenes are kind of the top six. There are fundamentally, there's over 200 different terpenes in cannabis overall.
For sure.
Yeah, this isn't the only list that's out there. This is kind of the top six that people that we know about and people request.
Absolutely. And while a lot of these are seen on those charts there, those COAs, those certificates of approval there, they're going to tell us what percentage is that flower. So if we find a flower that has a higher terpene percentage, we then can be more controlled with our dosing practice. So if we can use less flower to get the same amount of terpene, we can consume less THC to get the same effect, well, that terpene drives the entourage there. So
Sure.
when we look for products that move there, we see that we now just released an extract that has up to 7% terpenes there. We have flowers that clock in between 3 to 5 terpenes, 3 to 5% terpenes. It's all about really having that communication with your med tender and taking the time to really figure out where your sweet spot is. So that's a part of the conversation there at Move.
Sure. And again, we did a webinar a couple of weeks ago on terpenes, and so you can go to Marijuana Aware, you can go to the follow-up page, and you'll be able to see that particular webinar if you want to check that one out. But we also will be doing another webinar next quarter just on terpenes. That's a very important part of the cannabis journey.
Mm-hmm. Yeah, absolutely. And Nick just made a good point there too when he was talking about, reducing the amount of THC you might have to take to get the same effect, and that really goes to that entourage effect as well. CBD actually reduces the psychoactivity of THC as well. So, again, combining CBD with THC can help you get the same effect that you're seeking while using a lower amount of THC. So really the combination of terpenes, the other cannabinoids, all of those things really helps you maximize what you're trying, your product that you're purchasing, and also maximize your dollar, because at the end of the day, the more cannabinoid that you use, the more expensive it's going to be. So if you can find your proper dose and minimize the amount that you use by making a good selection on ratio, on CBD to THC ratio, on terpene profile, you can really save yourself some money as well. Rather than just trying to blast it with as much THC as possible, which some people fall into that trap, unfortunately. Sure. That may not be the best solution. So again, when we talk about, but all of this kind of goes back to individual variation, right? So you can see just from our first few slides how this is not the same as, your doctor writing 50 milligrams of low pressure, take one tablet twice a day, and you don't have to, it's not going to be the same for everybody. It's not going to be 50 milligrams twice a day for everybody. It could be 10 milligrams of 1-to-1 for one person and 30 milligrams of 4-to-1 THC to CBD for another person to get the same effect. So it really does take some trial and error a little bit, and trying to really focus in, having those conversations with both your doctor, your med tender at the dispensaries, to really focus in on what your goals are for treatment and what you're trying to accomplish. Because when we talk about this slide is exactly right. Here some adult patients receive therapeutic effects at 1 milligrams of total cannabinoids, while if we talk about seizure patients using really high amounts of CBD to control severe seizures, they can take over 2,000 milligrams of CBD a day, which is hard to imagine, but that is, it's absolutely true. But it just goes to show you how broad, how number one, non-toxic medical cannabis is, because there is really no upper end of toxicity, that we talk about with cannabis. You don't have to worry about that part. It's just finding the right dose that works for you and minimizing what you have to take to get the effect, ultimately is what you want to try to do. There's actually a concept there, a name for this concept. It's called microdosing. And what microdose means is taking the minimum effect that will give you relief with the minimum amount of side effects. So when we talk about medical marijuana, typically the side effect that we're talking about is euphoria. It's the high, right? It's the intoxication. Most people, if they're trying to, they want to function throughout the day, our whole goal with medical marijuana treatment is to improve your quality of life. And for most people, being blitzed out of their mind all day is not a high quality of life. That's not what they're after. They want to feel better and still be able to function well at work, to function well doing these things. So, microdosing as a concept is important because we do want to minimize those side effects as much as we can. So when you hear a doctor talk about start low, go slow, this is the concept that we're using. We want to increase the dose in enough to make a difference, but not so much that we miss the mark and go from, it's not quite working to, I can't get off the couch. We want to be in between that and function well throughout the day. So it is important to, especially when you begin, for more experienced cannabis users, this is not as much of an issue because they have a little bit more, they know what the expectations are. They sort of know where their parameters may be a little more than someone who's brand new to medical cannabis use. But those that are brand new, using a dosage form that you can adjust at home, like a tincture or a dropper, or you can take a quarter dropper to a half dropper to 3/4 of a dropper to sort of adjust that dose is a good idea. Or an edible that maybe you can split up to, a quarter or half or 3/4 of that edible to kind of figure out how it works. Those sorts of things is what is what I mean by dosing adjustments. Usually you can find those without having to buy a whole bunch of different products to find them. Again, we want to be economical with this. So when I talk about, using those sorts of dosage forms, you can adjust without having to necessarily buy another product. It won't always work for everybody. Again, most patients will start off with a 1-to-1 CBD to THC product if they're new. But if you have, if you're trying to get better sleep or your pain levels are higher, you may have to get a higher ratio THC product, or vice versa. If you're, if the 1-to-1 may be too intoxicating for you, you may have to get a higher CBD dosage. But most people starting off with that 1-to-1 with a terpene profile that suits what you're trying to accomplish is a good place to start. And then using that again, that quarter dropper, half dropper, 3/4 dropper to sort of adjust your dosing the way you think
what you're really looking for, and let me put it in layman's terms. What you're really looking for is, what is your tolerance to THC? At what point, how much THC do you take where you begin to feel the euphoric effect?
Yeah, I mean, exactly. Because ultimately that's really what's going to drive your experience with the medication, right? It's how that's really the biggest side effect, or THC related. So it is, you're exactly right, Mark. That's a simpler way to think about it. You're just trying to control your experience with the THC level in the product that you're using.
And your body will tell you. I mean, your body will tell you if you're getting your euphoric effect or not.
Absolutely. Well, it's not hard to, for those, especially if you're new to using it, it's not hard to know when you feel a little off. And for some, again, it's just your tolerance level on that. It's how well you function, how well, how much you can tolerate, while still controlling that symptom. This is another way to look at this that we're talking about here is most medications, the more you take, the stronger the therapeutic effect, and also the higher likelihood of negative side effects happen, right? So if you take, if the doctor tells you to take 1 Xanax and you take 3, then you're going to be, you're going to be more sedated and you're going to have more adverse effects from that as well. But cannabis is a little different. Most drugs have a monophasic dose response relationship. Cannabis has a multiphasic dose response relationship, which means if you look at this chart here, you get this little high slant here, you get the increased in response, but then it kind of levels off. You stop getting the therapeutic response and all you start getting is the side effects. So, what that means basically is at some point, your pain relief you're not going to get any more pain relief. You're just going to get more and more intoxicated. So we want to be in the sweet spot here in the middle, where we're getting a good balance of response to side effect, basically here.
Again, your body will tell you, again, if you're getting a euphoric effect or not. Your body will tell you if you begin to feel better. I mean, You will feel better, and that's where you know that you're there. And it's hard because you can't necessarily ask a friend or even ask a doctor, because the doctor's going to turn around and say, "How do you feel?" It really is personalized. This is personalized medicine.
And there's actually medical benefit to this as well. There are studies out there that show, patients actually will typically respond better at this optimal range than they will at a very low dose or very high dose. This was in a study that looked at this. They looked at 263 cancer patients treated with opiates, and they looked at they combined THC and CBD for these patients. And they increased it. They gave them different dosages to see how they responded to pain. And really, the mid-range, the 52 milligrams per day group really had the best pain response. When they increased that to 83 milligrams a day, the pain actually really, it didn't help the pain much at all. No better than placebo, and experience more side effects, because you can actually overstimulate the Cb1 receptors. You can actually cause overactivity by overstimulating them with THC. So again, this is what you want to find the sweet spot here, where again, this combination of THC and CBD, find the spot that works best for the pain relief.
One of the things that comes up, Turner, is the combination of CBD and THC. And I say that because when I had herniated discs in my neck, I would take more THC because THC was going to handle the pain. CBD was mainly for inflammation. And then, so if I had some pain, I'd take a little more THC to the point where I, hopefully to get rid of the pain. What I found one day, I ran out of THC. So I took a little bit more CBD and the pain went away. Or it went down. I shouldn't say going away, it went down.
Yeah.
And what happened was by reducing the inflammation, it reduced the pain.
Yep.
And I kind of went, gee, that's kind of interesting. I was going after the symptom and not the problem. And
yeah, exactly. Well, we don't appreciate how big of a role inflammation plays in a lot of pain out there. There are certainly some conditions out there that are nerve driven, neurology, if we think diabetic neuropathy, those sorts of things that are really driven by irritated nerves. But most pain has a very strong inflammatory component, and controlling that inflammation is a key part in controlling the pain levels. So again, having that ability to reduce inflammation with CBD while also reducing the pain signals with THC is just a really good tool. It is important to take enough CBD to reduce that inflammation, like you mentioned, to get the best effect out of it. One other aspect of one advantage of finding your lowest dose and using the lowest dose possible is the avoidance of the concept of tolerance. So using high amounts of THC will cause a tolerance to build up within the endocannabinoid system. These are slides here of actual Cb1 receptors on cells. And you can see as the amount of THC is increased over a long period of time, you start to see less and less of these Cb1 receptors present on the cell. What happens when a lot of that, and this happens in lots of medications, but if you overexpose the cell to a particular chemical, then they'll actually pull those receptors back into the cell to protect itself. They're saying, oh, hey, man, I'm getting overstimulated here. I'm going to pull back these receptors so I don't get exposed to so much of this. And that's where that tolerance comes up. Then you have to use more THC to get the same effect for that. So by using a smaller amount of THC, that buildup of that tolerance will be a slower effect. It will be easier to reverse. You can typically revert, the nice things about cannabis is that taking a drug holiday for, a week or 2 weeks can really reset the tolerance of receptors in the endocannabinoid system. If tolerance builds up, but you want to, the lower amount that you're using, the easier that is to reset, obviously. So again, that's another advantage of using the minimal amount of THC that possible to keep the effectiveness of the medication as going as long as you can, and again, reducing costs by avoiding, that dose escalation and having to buy more product every month to get the same effect. So all those things, just something to keep in mind there. Tolerance is something that can happen with THC over time. Yeah. So minimizing the amount that you use can reduce that.
Now, Deborah asked a really good question, and I think it's appropriate at this point in time. She was asking, what do you recommend for tolerance buildup for cannabis? In other words, I know, like, for example, I take you might want to mention like a holiday, your dosing holiday, because that can help quite a bit. I think that's appropriate right now to mention that. Yeah,
no, exactly. It's, that's really the best way to reset those. You can think, if we go back to your alcohol analogy, if you have gotten used to, drinking a couple of drinks a night, or a couple of drinks a week, and then, you stop for a few weeks and then you start again. Well, that's all of a sudden, hey, those same amount of drinks all of a sudden have a lot more effect on you. It's very similar to that with cannabis. It's a very quick reset. So drug holidays of 1 to 2 weeks usually will be very effective to reset those receptors. You can also, again, reduce the amount of THC dramatically and increase the amount of CBD if you don't want to take a drug holiday completely off of that to sort of keep some relief in there. But basically, you want to take as much of a holiday from that THC as you can to kind of help reset those receptors.
I mean, what you're really talking about, I'll use myself as an example. About every 6 to 8 weeks, I try to take 2 days off. I'll take at least a day off and just not take any cannabis at all. What I'm doing is I'm letting my body reset. It's what Turner was mentioning. My body kind of resets. Now, in my particular case with 7 herniated discs in my neck, after about a day and a half, my neck taps my shoulder, taps me on the shoulder and says, if you don't do something pretty quick, you're going to have some pain. So I can't say that I'm addicted to cannabis. I'm not. I can stop at any time. I have no withdrawal effects, nothing like that. What I am addicted to is getting rid of my pain. Okay. And the only thing that I have found that gets rid of my pain and doesn't have any toxic effects is medical cannabis. That's why I do that. But again, I do that about every 6 weeks, 8 weeks. I take about a day and a half off. And I also found that if I reduce the amount of THC and increase the amount of CBD, it also helps as well.
Yeah, no, exactly. This kind of goes, we're talking about that THC and CBD combination, that entourage effect. I've had the slide up for a minute, so I'm sure everybody had a chance to look at it. But basically, this was a study that sort of backed that theory up of CBD plus THC having being superior in pain reduction. We had this particular study, they used a high THC product of 27 milligrams a day, and they used a CBD plus THC product of 60 milligrams a day. And the CBD plus THC group had a better reduction in pain. So basically what this sort of showed was that, the CBD plus THC worked better than THC by itself for pain reduction. And this was actually a quantified study that showed that. So
now I'm gonna throw a shameless plug in for Move right now. One of the advantages that I love about the Move products is you have Nick, you can maybe comment on this. You have a CBD product, you have a one-on-one product, and you have a THC product. So when you're trying to find your sweet spot, you can actually get your CBD. You can start with your one-on-one, for example, and then you can implement and you can add a little more THC or CBD to where you find that euphoric effect. But you have the ability to increase the amount of CBD and THC without having to buy a bunch of products. I know there's a lot of the dispensaries have what they call ratio products, and you got to buy 3 or 4 different bottles of stuff in order to be able to figure out what that sweet spot is. Is that right, Nick?
Absolutely. You're able to build your own ratio with this here. And when it comes down to the creams and to the actual relief gels, we can either take the topical approach or actually go right through with encapsulation technology and localize the effect right through the bloodstream. So I'll talk a little bit more about that when we get to the slide back there, but there's a lot of really, really great ways to build these products around your pain tolerance and your THC tolerance, really.
Right. I think that's important, is in order to be able to find your sweet spot, you need to know what level of THC and CBD, but you got to play with it a little bit. It's kind of like, I wish I would have learned that when I was learning how to drink. Go low and go slow would have been a good policy.
They never told me.
I get a second chance to try that out, but it really makes I now know my tolerances, so it makes a difference. So a lot of people say, well, how long does it take to do that? It took me about a week and a half, 2 weeks, by the way.
Yeah. And just all good points. Just moving along here, when we talk about finding your dose, I think that's great. Move has those products that you can really build that ratio, because that is, not every dispensary has that, and it is nice to be able to sort of self-control that aspect of it for sure. But again, factors that influence dosing overall, the route of administration is important. The biggest difference between the different routes of administration or how long of an effect the product will have. Oral products have a longer duration of action than inhaled products. They do take longer to work, but if you're looking for something to keep you as sort of a steady state throughout the day, or you're trying to keep you asleep at night, oral capsules or edibles may be the best way to go. If you're looking for quicker relief that'll wear off quickly, the vaporizers or smokable products, inhaled products are a good options for that. Terpene profile, we talked about the potency of the product. We talked about ratios, THC to CBD, but again, with another aspect of this when we go in the dispensaries is the potency, which means how much cannabinoid is in that bottle. So you have a ratio, say, of 1 part CBD to 1 part THC. The bottle itself will hold 300 milligrams. Well, that 300 milligrams is the potency. That's how much cannabinoid is in the bottle. It could be 300, 600, maybe 80, whatever it may be. Obviously, the more potent the product, the more expensive it's going to be. But what that basically means is how concentrated is it. So, for example, you'll have to use more of a 300 milligram product per ml than you would a 1200 milligram product per ml for the same, from a quantity standpoint. That's why potency and concentration are sort of interchangeable there when we think about that word. Isolate versus whole plant extract. Again, this is sort of what Nick was just alluding to. Isolates are usually chemically extracted, and all it is either just CBD or just THC versus whole plant extract, where you have more of the multi-cannabinoid, more natural plant profile that we talk about, the entourage effect. So that's something to watch out for as well. And ECS tone. Now, what this means, endocannabinoid system tone, that basically means how well your personal individual endocannabinoid system responds to cannabis. So when we talk about individual variation, this ECS tone is sort of a fancy word to describe that individual variation.
Yeah, everybody has a different. I know, like my wife's ratio of CBD to THC is very different than mine, and so it's a matter of just finding what that is. And once you find it, it's great.
Yeah. So I'll let Nick take this slide. This is a good representation of a lot of the dosage forms that are available out there.
Yeah, Nick, when I got involved in medical cannabis, I had this picture of everybody sitting on the front porch smoking a fatty. I think that's true. The medical cannabis field is migrated a long way for a lot of different ways of being able to take medical cannabis that really suits your lifestyle.
Well, smoking that fatty on the porch with your friends really was a wonderful thing to remember, and there definitely will be a time again for all that. But we are at a microdose webinar right now, and one thing we got to remember is that a gram of marijuana can get, and a pre-roll, and we have our doobies that we sell. A gram of marijuana can have anywhere from 150 to 300 milligrams of THC in it. Mm-hmm. So if we smoke that whole joint, that's a little bit more than a microdose right there.
Yeah,
that's a long trip. So remember, everybody, that we can always put that out after a couple puffs, and we can have a couple moments to really reflect on what's going on there, as opposed to just saying, hey, I can smoke this whole thing. And when we look at this chart here, we have a lot of different options that have a spectrum between microdose and macrodose. So when we look at the tincture there, that's something that we can keep under 5 milligrams. And we here at Move, we call a microdose 5 milligrams. So anything over that is going to get into that macro territory, where you're going to find that euphoria. You're going to find that that little bit more sedation. But when you're trying to find your ratio, that's something that you're going to explore on your own terms. And that's the best part about Move, is that because of the precise dosing, because we know that there are 300 milligrams in that bottle, and we know that one dropper has 10 milligrams there, you're going to have that confidence to move forward too. So when we also go ahead, Turner.
Oh no, you go for it.
But on the subject of low microdoses here, we also have the Evolve cream, which is encapsulated technology, which actually will give a 5 milligram pump of cream that you can rub right through your skin, where it's going to go right through the blood barrier directly into the system. So it's really, there's different delivery routes that we can all appreciate, whether it's something that we're trying to go directly into the bloodstream, or whether we want to go through the skin. Over at the edibles, I know you talked a little bit earlier, Turner, about breaking some in half. And the really beautiful thing about edibles with Move is that they're homogenized, meaning that the amount of THC is even, and CBD for that matter, is even throughout the piece of candy. And I hate to refer to it as a piece of candy, because this is medicine, but it just so happens to be in a delicious form. And what we can really remember at the end of the day is we can cut that in half. That gummy's 10 milligrams, cut that in half there, that's a microdose for you. The chocolates are 10 milligrams, but you can split those. And that way, that's a 5 milligram dose on either side. Now, our lozenges, those are 10 milligrams, and that's a sublingual application. So I'm going to call that a macrodose, because that is not easy to break in half. That's something that you're going to be able to just kind of let dissolve and find relief with. I'm a big fan of those. I definitely found a lot of relief with that. And I know that Marc's a huge fan of the patch. That is our true microdose right there. That's a 72-hour experience where there's 0.24 milligrams per hour of THC or CBD that are delivered through your system. So when it comes down to it, we have all different ways to approach the system, up to and including a meter dose inhaler. So those are going to be all on our microdose side. On the macrodose, we have those big old joints that we were talking about earlier. We've got the vapes, of course, there's concentrates. And we were talking about terpenes earlier, and about having those higher terpene contents there. you're going to find those in concentrates. So if you're able to really dial in your practice of smoking them and actually find a very, very small amount that you're able to take each time and not go on for the full rice grain size 25 milligrams, you're able to get a lot more terpenes from the concentrates than flower. So something to think about.
Run to the next slide, because I think this is really important. I know you're going through a lot of the products. What's interesting is the tincture drops, for example, go underneath your tongue, and they'll take like 20 minutes to 45 minutes to work. I know in my case, it's 20 to 25 minutes, but they'll last 4 to 6 hours, where if you take a look at a vape pen, the inhalation, that works almost immediately, and that'll last from 2 to 6 hours. I mean, each of those different dosing forms has a different characteristics, right, Nick?
Correct, yes. And that onset is a really important part about it, because with the encapsulation technology, like we said earlier, it's water soluble, it immediately goes into your bloodstream. You can have that tincture that really takes in 20 minutes and gets right into your system. But when we're taking it in inhalation route, it happens almost immediately. So that those terpenes are really a lot more quickly absorbed into the system. The patches, obviously, it takes a little bit longer to get there because it has to go through the skin. But that's something that is actually able to be turned off after. And when you take that patch off within 45 minutes, the effects dissipate. Have you ever had to take a patch off, Mark?
Yeah, actually, that's a really good point. The one nice part about transdermal patches, it's the only dosing form that if you put it on, you can actually take it off and then reverse the effect of it. Everything else, if you eat an edible or you do a tincture or topical, you're kind of committed to the dosing form. The patch allows you, especially when you're first beginning, you can really help figure out your THC levels and your THC tolerance and your CBD tolerances by things that are out there. I know there's a question about somebody who's having trouble, and we'll address, JR, we'll address your question about insomnia, because some people have the reverse effect where CBD and THC have the opposite effects on some people's bodies. And this is where the transdermal patches will help you be able to determine what that dosing ratio is. But I love transdermal patches because I can put one on, it'll last for 3 days, and then I can just supplement. If it's a THC patch, I supplement the CBD and vice versa out there to adjust for the pain levels. And actually, candidly, the activity. I mean, I'm a senior citizen. So, my body isn't the way it was when I was 20 years old. So if I'm out working out and doing certain things, I tend to have to increase the amount of CBD, but I also have to make sure the CHC is there to be able to handle the pain that's there.
Absolutely.
Now go back for a second. I want to, really important. One of the things that happens is that my regime, because I have herniated discs in my neck, it's constant pain. So when I get up in the morning, I take my tincture drops. On my nightstand, I have the tincture drops, and I'll take those. But that's going to take about 20, 25 minutes of work. So what I have right next to it is a vape pen, and I'll take a hit, 1 or 2 hits out of a vape pen, depending on the pain level in my body. And what's interesting about the vape pen is it works almost immediately. And I say that because the first time that happened, I said to my wife, "This is crazy. It's like somebody took a rag and wiped my back and all the pain went away." And it was true. I mean, my pain level went from a level of about 7 down to a level of 1 and stayed that way, which I found very interesting. So you can kind of mix and match based on what you need. Like, for example, if I take the tincture drops, it'll last till the early afternoon, and I've got to do something in the early afternoon and it to take me through the day, and then I have to do something in the evening to take me through the night. So there's different, this is called my regime. I have a regime that works 3 times a day, and you can mix and match these different dosing forms. For example, I could put on topicals, that'll help me quite a bit, especially for my neck that's out there, or the transdermal patches. So mixing and matching is really important.
Yeah, no, exactly. And we can see in this next slide sort of why that is.
Right.
This is there's actually some good science behind this, and the way that inhaled products and ingested products behave in the body are very different. So inhaled products, there's something when you take a medication, and this goes for any oral medication. If you take a capsule or a pill, it goes first through your GI tract and your liver, and there's something called first pass metabolism that happens that really changes the form of that before it gets into the bloodstream. When you inhale a cannabis product, you avoid that first pass metabolism. So it essentially goes straight from the lungs into the bloodstream. So we can see that's why it works so quickly. You get the delta 9, this red line here, a very quick spike at about 5 to 10 minutes. And then it drops off rapidly at an hour to 2 hours here. You can see the effect drop off. You do get some other metabolites in there, the 11-hydroxy THC, a little bit from inhaled, but the majority of it directly into the bloodstream, the delta-9 THC from the inhaled product. But when you ingest the product, when you swallow it, again, it goes through the digestive system, and your biggest metabolite there that comes up is this 11-hydroxy THC, and it is. What's interesting about this particular metabolite is that it is much more potent than delta-9 THC. So even though your THC level may be lower in the edible product than it is when you inhale it, because this metabolite is so much more potent, when we hear these stories about people really sort of overdoing it on edibles, it's because they're getting a very high dose of this very potent metabolite and can really get over intoxicated if you're not careful. So because it is a slower effect, again, you see it kicking in here at 45 minutes to an hour and a half, really starts ramping up. A lot of people will in this ramp up time maybe take another one because they think it's not working. And then that's where you really kind of get the over intoxication there. But the advantage, so that's something to be careful of, but the advantage here is you can see the time frame when you take an edible is that it really, or a capsule or any swallowed or ingested product, but the time frame is really long. So when we're talking about staying asleep all night, if you're taking something for sleep, this is really great because you can take a capsule at 10 o'clock and 6 to 8 hours later it's just wearing off, and you got a good night's sleep and it kept you asleep all night. But again, that may not be the ideal thing to do for if during the day, if you have to get in a good day's work, if this really kind of makes you sleepy and drowsy. So then we go back to an inhaled or faster acting product that may get out of your system quicker, or one that's higher CBD, lower THC if you're going to use a capsule, because you want to be careful with this with these metabolites that happen from an oral dosage form. So you want to take a much lower level of THC than with that edible product. So again, things to consider, with those sorts of things that we may, are not necessarily common knowledge, but there are reasons that you do. There's a reason they feel different. There's a reason inhaled products and ingested products feel different when you take them, and a lot of it has to do with these metabolites and how long they last in the body. Again, it's just another graph showing this here. When inhaled, you get a much larger portion of delta-9. When ingested, you get almost a 50-50 11-hydroxy, which is 3 to 7 times more potent than delta-9. So again, it's just something to keep in mind as it's not always apples to apples when you're talking about comparative doses from inhaled to ingested products. So just adjust accordingly and be aware of how that may affect you throughout the day. One thing a lot of people are concerned about, we all know about side effects and toxicity of medications, and something we rightfully should be concerned about. Marijuana is an odd bird in this particular picture. Cannabis, this chart that I have here on the screen is a chart that we see a lot in the pharmacy world, but this is a chart of ratio of fatal dose to effective dose of different chemicals here. So what that means basically is if we take a look at alcohol here, so it has a ratio of 10. So that means basically if 1 shot of tequila were enough to get you drunk, then 10 shots of tequila may be enough to be fatal for you individually. Again, that all depends on tolerance and those sorts of things. So when we talk about effective dose, that would be, of alcohol, that would be an amount to get you intoxicated. Again, we look up here, dextromethorphan is an interesting one, also has a ratio of 10. That's over-the-counter cough syrup. It's in almost every over-the-counter cough syrup out there, but it has a pretty low toxicity ratio. So, it's something that's sold over the counter. You would think, it would be a lot safer than that. But again, it just kind of goes to show you, how important it is to take things as directed and to be careful with these some of these products and toxicities out there. But if we look up here at cannabis and marijuana, it has a ratio of over 1,000. So again, what that means basically is you would have to smoke over 1,000. Actually, that there was actually an article that came out a few years ago that one of the congressmen from a legal state, they had a hearing up on Capitol Hill, and the guy was giving the DA guy that was testifying a hard time. He said, "Okay, you guys still have this as a Schedule 1, say it's super dangerous. How much would you have to smoke to be fatal?" The DEA agent actually said, Yeah, you know, we've done the studies on this or looked at the studies. You have to smoke over 1,500 marijuana cigarettes in an hour to be fatal. So, you know, that it could be done, but you'd really have to try hard, basically. You know, I'm not sure how you pull that off exactly, but that just goes to show you, though, the very low toxicity level of cannabis. There's a reason for that. When we talk about that endocannabinoid system,
and more importantly, Turner, no one's ever died. There's been no
exactly, no, and there's a, you know, and because it's just not toxic.
Right.
There's a reason for that. There's actually, you know, we talked about that endocannabinoid system earlier. When we talk about overdosing on drugs, on alcohol or opiates or benzodiazepines or whatever they may be, we hear these people dying tragically of drug overdoses. They typically die from a depression of the respiratory system, the depression of brain stem activity, the part of the brain that sort of controls all your heart rate and your breathing and things that we don't think about. But for whatever reason, the way our brain developed, there are very few of those Cb1 or Cb2 receptors in the brain stem. So marijuana just doesn't affect the part of the brain that keeps us alive, essentially. So that's why the toxicity level is so low and why there has not been a fatal overdose, because our brains just aren't wired, you know, to have marijuana affect those parts of the body that keeps us alive. So,
and that's both medical as well as recreation cannabis.
No, exactly. Cannabis is cannabis. Yeah, exactly. It just doesn't affect that part of the brain. So that's the reason for the low toxicity level.
So tell us about how to achieve your CBD to THC balance.
So, you know, Nick touched on this a little bit a minute ago, and I think he described it pretty well. But really, you know, one thing to keep in mind is in Florida, products containing over 0.3% THC can only be purchased with a Florida medical marijuana card. You have to be approved by a physician. Only the hemp-derived products of less than 0.3% THC can be purchased without a Florida medical marijuana card. Sometimes, you know, one thing, it depends on what your ratio is and depends on the dispensary you're using. You know, with Move having an isolate of CBD and THC, that really, you know, helps to find your ratio and the proper ratio. But a lot of the dispensaries out there don't always have CBD product in stock because it's not the most popular product they sell. And, you know, for the dispensaries, it costs just as much to grow CBD as it does to grow THC. So sometimes they have to make a decision on what they're going to grow there. You know, but we want to make sure that, you know, we've touched on how important it is to have that CBD to THC balance. So whether you buy it from Move or dispensary, or whether you buy it from a hemp-derived CBD product, we think it is important that you use the CBD no matter what. We you know, our doctors here, we have a CBD line. If you can't find one in the dispensary that we offer, that you can ask our doctors about. We have a website with it. But again, you know, just going to touch on that as an option.
Go back for a second, Turner, because this was important. A couple of years ago, we had a big discussion in MMTC. How do you know a quality CBD product? And right. Yes, there are products that Move is unique in that you can go to a dispensary to get it, but you had to have a medical marijuana card to get it. And how do you find that quality CBD product? Hence why you ended up putting together that whole program for My Botanical Wellness and putting out a set of doctor recommended.
Yeah, we were very hesitant to offer CBD until there was a sort of a standardized format, which Florida has now come up with through the Department of Agriculture for CBD products. That they do have certificates of analysis. Certain ones do, so we make sure the ones that we carry do have that. But again, it's just sometimes it's a price point issue, sometimes it's an availability issue. Basically, we just want to make sure our patients have access to CBD as well as their THC to get the maximum benefit from their medical cannabis therapy, you know, whatever it may be. So because it is, you know, just very important to give both of those cannabinoids in a reasonable ratio, you know, to really maximize the effect if you really are trying to.
One of the important points about it is that if you start feeling the euphoric effect from taking maybe a product that has the THC is beginning to affect you, you can take some CBD, some pure CBD by yourself, and it'll reduce the euphoric effects.
Yeah, and you know, it can be, you know, if you've already been to the dispensary, you purchase some product, it can be a cheaper option to sometimes buy a little extra CBD over the counter than to buy a full spectrum, you know, or a marijuana derived product that may have a little more THC in it. So again, just do those cost comparisons, to sort of make that decision as well. It's all about, maximizing your effect, but also maximizing the effect in your wallet. You want to do the best you can on both sides of it. Again, and if you need a little more CBD, sometimes, just kind of do your price shopping. As long as, again, look for those certificates of analysis. Make sure all the products have them, whether it's a CBD product, hemp derived, or a dispensary derived marijuana product. They should all have those COAs online. Those certificates of analysis that you can look up for each lot number that you purchase on that. Potential adverse effects of medical cannabis, we talked about the euphoria effect, the dizzy, you're tired, the intoxicating effects of THC. There could also be some other less common ones, eating more or less than usual. Nausea, there's been some articles lately about, they call it hyperemesis, people getting sort of uncontrolled nausea from THC use. But again, that's when you read into those articles, that's really high THC use over a long period of time, typically, much more in a recreational sense than a medical sense. The doses that these people are taking are a lot higher, a lot more concentrated THC. So that's not really a concern for the most part for medical doses and what we're trying to accomplish here. But it is something to be aware of if you do start feeling over nauseous or you do want to let your doctor know about that.
One of the things that's not on this list, Turner, is dying. You don't die from medical cannabis.
No, you don't. That is something you don't have to worry about.
Something that's very important to point out.
Yep, absolutely. But in most of these that you see, these less effective, the less common ones here, once your body adjusts to using cannabis, these are very unusual long-term. You really don't have long-term effects like this. It usually resolves itself pretty quickly once you get used to taking it. So it's a very, it's fortunately just a very low risk, low toxicity product to use. There's very few conflicts with other medications. If you're taking blood thinner like warfarin or Coumadin, that may be something to be aware of and let your doctor know. It may take a dosage adjustment. It's not a contraindication. You can use medical cannabis and take a blood thinner, but you may have to slightly adjust your blood thinner dose, over time for that. So just let your cardiologist or whoever's managing your blood thinner therapy know that you've started medical cannabis or using it, because it may cause you may need a dosage effect there. This was again another study on safety. This particular review looked at 31 different studies. 23 randomized studies, found that 96.6% of adverse effects from cannabis were not serious. So again, just another example of the low toxicity, low risk of using cannabis as medicine.
I don't think there's any pharma drug out there that has that kind of a...
It's pretty rare, I can't think of one that, even Tylenol, you have liver toxicity and liver failure. It's one of the, Tylenol is actually the top cause of liver failure in the United States. So there's very few that have such low long-term effects for sure.
This goes back to our questions at the beginning. It didn't work, so I quit. What the answer to that is really adjust your dosing. Start low, go slow.
Exactly. But start low, but don't stop low. Either if you start low and it's not working, you don't be afraid to experiment and raise that dose a little bit, because most people will have to increase the dose somewhat from where you first start. So don't just give up on it there. It does.
And if you get to that euphoric effect, have some CBD on hand, take the CBD and it'll reduce it.
Yeah, exactly. And that kind of goes into that second one. Felt high, it was an uncomfortable experience. Obviously you want to adjust your ratio, you want to take less THC, you want to lower your dose. There are lots of options there. It works, but not as much as I'd hoped. Again, that goes back to just adjusting your dose. It's for most people, it does take a couple of dosage adjustments. And if it's still not working after trying your dose adjustments, talk to your doctor. You'll probably have to change the ratio or change something else other than just the amount you're taking. But for the vast majority of people, you can get a solid benefit from medical cannabis for most conditions there. Yeah. So, and as far as getting help with dosing, you know, your physician that you get your card from should really be able to help you with that. I know at MMTC we have dedicated staff that just help people with dosing. Your dispensary staff, like your med tenders, like a Move, are good resources as well. So yeah, just don't be afraid to ask a question. It's not an intuitive thing. It's not a common sense thing. For a lot of people, there is no such thing as a stupid question. Just, you know, don't be afraid to ask, and you know, it's about your health, right? So it's important, you know.
I know Nick's going to give us some information on Move in a moment, but I think also, Nick, you have Move has a counseling session that you can get to. You can actually call Move and actually set up a telemedicine or an in-clinic counseling session, right? And that's free.
Yeah, they're right on the website. We set up it's like a Zoom call where we set up a full consultation where they're going to give, and even if you're not a patient yet, you just want to learn about Move, you want to get a little bit more idea about the product, this is something that you can reach out to and use to. But even when you are and you come into the store, we have consultation rooms ready to go, as well as just at the counter. Our med tenders really do take the time to understand what's going on and how they can best help you. So like we said, like Turner said, it's all about communication and really saying, what can we do to get to this next step?
Turner, why don't you flip to the next slide? I know that Move has some world-class products, right, Nick?
Oh, for sure. And when it comes down to the to the microdose in the spirit of this webinar here, we can look at the topicals as well as the edibles, tinctures, capsules, tinctures and oral spray, the transdermal gel, and 72-hour patch, as well as the metered inhaler. So those are going to be our microdose options. And as well as so when it comes to the macrodose, we've got the capsules where we have ratio products as well as 25 milligram RSO capsules. We also have the concentrates, and then flower and vapes. So there's a lot of different ways for you to take your medication in.
Yeah, but the next slide kind of explains what really the magic of one of the magics of Move. Kerner, can you give us the next slide?
Oh, yep, absolutely.
Yeah. Really, what you have is an encapsulation technology, which is very cool. In other words, this is something that sets you apart from a lot of the other dispensaries where your product goes directly right into the bloodstream. Why don't you explain that? Because that really allows you to use, candidly, less products, and the products are more effective.
Precisely. And when it comes to microdosing and to really getting that precise relief there, now at 4, and I wake up at 4:30 in the morning and I need to go back to sleep, I have the oral spray on my nightstand. That's 1.6 milligrams per spray. I take 2 sprays, I'm under 5 milligrams, and I'm back to sleep until just before 7 o'clock. And it's a wonderful way for me to go back down without having to go through many steps to medicate or have to worry about coughing via a vape pen or taking too big of a hit for that matter. But when it comes down to it, it's all thanks to it's actually a patented process. We were able to receive a patent to this, which I'm so proud of my company for being able to do. Being as this is a federally illegal product, we actually have this our encapsulation technology allows it to go straight through the blood barrier right as it's water soluble. So it's an encapsulation. It allows for full body effects, topical application of cannabinoids. And then with our patch option, it's a microdose. So like we said earlier, it's a 24 milligram per hour over 72 hours, whereas the cream is a 5 milligram per pump, or the tincture is based on the dosage and the dropper you take. So all microdose options. Right.
So Turner, give us the next slide. There you go. These are some of the products that you have that are out there.
Yes, this is. Those are the top left. We've got our flower. There's those big joints and the beautiful tier 1 bud. Our tier 1 buds are all hand selected and hand trimmed. After that, we visually inspect our tier 2, and then the tier 3 are a little bit smaller. Those are those gummies we were talking about earlier. Just beneath them, remember, we can cut them in half to make them 5 milligrams, and they are a homogenized dose, meaning that there's 10 milligrams of THC throughout the entire piece, meaning if you cut it in half, 5 and 5. And then up top on the top right, we've got our vapes and flower cups. That's going to be able to be used in that vape option, more of a macro dose. And then on the bottom, we have also a macro dose. These are our distillates, RSO tincture, as well as concentrates. And that really is going to be a lot more potent.
Sure. And then you take a look on the next slide, you have your vape pens and your flower that's there.
Yes, sir. And this is really where we're going to find a lot of those terpenes that we were talking about before. Those disposable vape pens are just, they're very small little testers, but they're about 0.3 in each one of them, but they taste unbelievable. And there's really a huge terpene profile on a small package.
Yeah. And you can find out, again, go to the med tender and he'll help you decide. He'll show you what terpenes are inside the product. And that answers, Shannon asked a question about that's the best way to look for the terpenes and for the effects. And that's where you talk to your med tender.
Precisely.
Right. And I think the next slide kind of shows your gummies, which are great.
Yeah, that's the close-up on them. The cool thing about these gummies is that they're actually this is an established brand out of Arizona. We partnered with Wana, and what we do is we actually cook below the boiling point of all terpenes so that they're not boiled off during the cooking process. And then on top of that, they actually reintroduce the terpene blends at 2% of the distillate mass, which actually aligns to the terpene profiles found in cannabis extracts. So that means you're going to get a full flavor experience from these little chews.
Right.
That's very cool.
Yeah.
Now you have one of these. Look, how much the one on the left, the strawberry lemonade, that's a 1-to-1. So it has CBD in it. I think a lot of people are asking questions about, can I find a 1-to-1 or a ratio gummy? The answer is yes. That's your strawberry lemonade soft chew.
And that's not 5 milligrams of THC and 5 milligrams of CBD. That's 10 milligrams of THC and 10 milligrams of CBD. Yeah. So when you split each piece, it's 5 and 5 of each.
Right.
That's a great product.
Yeah.
That's an important product.
Mm-hmm.
Sure is. But of course, there's also the indica, sativa, and hybrid as well. They are all delicious. I can attest for that.
Yeah. Now you also have lozenges, which aren't on here, and those you can't cut in half.
No, those are a hard candy, and yeah, that's a hard candy there. But as a sublingual product, meaning that it's going directly into the bloodstream, it's sitting under your tongue. Right. It really does give a little bit further relief, I feel, than to the gummies.
Well, tell me about strain print.
Strain print's an incredible tool. This is a journaling task where we've actually been able to bridge the research gap, where we have our Move Patient Pioneers. That's people like we have on this webinar right now. And as you start your cannabis journey, I implore everybody to go and download this application, because really it gives you a chance to find your own platform and have everything centralized to understand your own cannabis research. So this offers invaluable insights into the products and strains that work best for specific symptoms and ailments. So we as patients indicate when the beginning of medication session, what symptom we're experiencing and the severity of the scale between 1 and 10. Mm-hmm. We then receive a push notification after the onset of the effects, asking the symptom level after using the specific cannabis product. So that change in symptom severity is then scored as the product's efficacy in easing the symptoms. So basically, you start your session, you say, hey, I'm feeling anxious. I need to understand what's going on here now. You're now getting a push notification 20 minutes after you've had, or sometime after you've had your dose, and you're now reassessing the situation. So as a meditation tool, as a journaling tool, as a product guide tool, strain print really is a valuable place.
Mm. And more importantly, you're located you have 37 locations. And by the way, you introduce 1 or 2 every month.
And there'll be more coming. I'm grateful to take care of the North Florida region. So I'm up in Jacksonville. If anybody's ever in the neighborhood, stop by in St. Augustine, stop by in Jacksonville Beach, downtown. We'll be out in Gainesville as well as Ocala. But when it comes down to it, you can find relief just about throughout the state right now. And if it's a little far away, we do offer delivery right now through the month of October. Delivery is free on orders over $100. After the month of October, it'll be free over $150. So if you're able to stock up and make that work for you, it's a really easy way to skip that step of getting to the store. Sure. But more locations coming soon. And our website is, just to remember, our ordering system is based in real time. So if you see something at, let's say, Gainesville, and we saw those blueberry gummies there, and we said, okay, I want to reserve these blueberry wanna chews, soft chews. In Gainesville, they're taking them off the shelf, putting them in a bag, and holding them for 24 hours until you get there. If you call, they'll hold them for another 24 hours. So it's real-time system that you're seeing on the website. So
there's a couple of ways of reaching you as well. That's the last slide that you have here.
Absolutely, yes. So you obviously you can give us a buzz over the phone. We're always available via chat. And of course, you're always welcome to come into the store as well. The front desk assistant will be happy to answer any questions if you're not a patient. And if you are, come on back, come explore. And we really look forward to having you in.
Feel free to set up a consultation. The consultation can be in person or telemedicine. I think that's really important. I think a lot of people are saying, where do I get support? There you go. And you're offering it for free.
Oh, absolutely. And it's such a valuable part of the cannabis journey that to start with, because if you have a solid educational foundation as you continue into this space,
Right.
your dosing experience is going to be a lot easier. So I'm glad that you guys joined in today.
Yeah.
Thank you so much.
So let's just take on a few questions here. I know Jeanette asked the question, how do I use RSO syringe? Is it best to put it on coconut oil and eat it? Want to take that one?
Yeah, Jeanette, thank you so much for asking. When it comes to the RSO syringe there, getting it onto whatever you feel is palatable, that isn't going to get stuck in your teeth, really is the name of the game. I find that it's a little bit difficult to work with, but if I get a Triscuit cracker, I can just kind of scrape a little bit out of the syringe and just kind of have a very, very small dose there. Otherwise, obviously, it can get pretty out of hand pretty quickly.
You're looking for about a rice size.
Yes, and when you're starting, even smaller for that matter.
You mentioned on a cracker, some people actually put it on chocolate.
Yeah, absolutely. Yeah, it really can go into anything that you feel is palatable for the moment there. You can put that on, and it actually is transdermal as well. You can apply that directly to your skin if there's an area that needs to be addressed.
Right. So JR had two questions. One question is, do edibles contain the entire THC CBD profile, terpene profile? I think you have both. You have one-to-ones and also THC based, right? Edibles.
Absolutely, yes. So the Move edible line has the hybrid indica sativa as well as a one-to-one in our gummies. When it comes to the terpene profile in our gummies, there are terpenes reintroduced there, and they're cannabis terpenes.
Right. Did you see JR's second question here? I don't know if you see it. He says he has a severe insomnia, which I can relate to, and you have used medical cannabis, both flower and edibles, and it seems to make my insomnia worse.
One thing.
You want to attach that one, Turner?
Yeah, well, just one thing that you could seek out on that. There are some products out there that have a CBN, a high CBN profile. CBN is fantastic for helping you sleep. It's another cannabinoid that's not as prevalent as CBD or THC, but it's starting to be used more and more in especially sleep products. So I would try to seek out an edible or a capsule, some sort of edible form that has a higher CBD profile, as well as the proper terpene profile, obviously. That may help, with that. If the THC is overstimulating you, having more of the CBD, the CBN, and a little bit lower amount of the THC would probably be the way to go with that. So.
And you may have a high sensitivity to CBD too.
Yeah, exactly.
A lot of people perceive that the only thing you have sensitivity to is THC, but there's a number of people I know that have high tolerances to CBD. So this is where you may want to lower your tolerance to CBD, maybe a little more THC, and see how that works out.
Yeah.
And then I think the other option is take a look at the terpene profile that you're using. It's not just a matter of indica and sativa, or you might want to look at the terpenes that are helping you get to sleep.
Yeah, exactly.
That are out there, like myrcene, for example, will help quite a bit in that particular category. So maybe those will help a little bit. You want to grab one that says, if I used a tad of DMSO with tropicals, did that reduce the amount of topicals that I need? You want to try that one, Nick?
When you say DSMO, I believe you're referencing RSO.
DMSO is it's a product that helps with helps increase the penetration, skin penetration. It theoretically could. I don't. There's a lot of debate about whether DMSO long term is a good idea or not, but yeah, I mean, it theoretically does increase the depth of penetration for a lot of different topicals. I'm not sure how it would jive with with the cannabinoids in there. I haven't seen any studies on that or anything, but theoretically, it might it'd just be one of those things you'd have to try and kind of see how it helped, see how it worked for you.
I think this falls in the category of it depends on your body.
Yeah. Well, I mean, there's a lot of DMSO has been around a long time. It's one of those things, it's a good anti-inflammatory. People use it as an anti-inflammatory by itself, but it also increases skin penetration. A lot of it goes right through kind of carries things with it. So I get the theory, the thought there. I'm just not sure that there's actually been any evidence that it works, would help or not. So
now, Emily asked a great question. It says, is the gel new to move, and would that help with cramps?
We definitely have been really promoting the gel a lot lately. It's not necessarily a new product, but when it comes down to cramps, I know that I've heard a lot of patient responses about the encapsulated technology gel, which is the encapsulated cream, as well as the patches, helping with cramps quite a lot, because you're able to put them right over the area where the cramp is happening.
Right. Now you had I know that for a while there, because of the supply chain, that some of the gels were in low supply at the dispensaries. And I'm just saying it's not something you guys worked on very hard to get the supply chain so you can get product into your dispensaries.
Because it's dedicated plants that go to each product, and everything has to be evenly distributed there. So as you said, it's tough to grow for space.
Yeah, I mean, one of the things I love about Move is, if you say you have a product, you can normally find it in the dispensary. You guys do a really good job of making sure that you're stocked up. COVID has thrown you a bit of a curveball, and you manage that fairly well. So
thank you.
Judy asked a great question. Are there terpenes in the tinctures and edibles, and how are they compared to other delivery systems? I'm looking for alternatives to inhalation because I have a lung condition.
Well, yeah, terpenes in there. Go ahead, Turner.
No, I was going to say, we touched on a little bit of the, as far as the way that the different dosage forms behave in the body, obviously with that, but it's really, to me, I don't think that, as far as actually getting cannabinoids in the body, I don't think that the dosage form is the crucial part. They all serve the same purpose to get the cannabinoids in the bloodstream. It's just about finding the right one that works best for your symptoms. On that. So, but yeah, with a lung condition, absolutely, I would think either the tinctures or the edibles or either the topicals might be something, depending on how severe your condition is, as to which one will work.
Or a capsule. You might want to take
or a capsule. Yeah. It's kind of lump edibles and capsules in my same thought process there, because they work the same. But yeah, either way, edibles, capsules, any oral dosage form there. So.
Right. And when it comes to terpenes in the tinctures, we actually make an RSO tincture that is a liquid form of the RSO that gives you a whole lot more of a full spectrum experience, because you really get that taste in your mouth, and it'll give you a more true to flower experience as opposed to just that sticky goop. And it might be a little bit better of an option for you to explore one time.
I mean, I like your tincture RSO tincture drops. I think they're great. So,
thank you.
Okay, an anonymous question it says, I primarily use the sublingual drops, and I used them this weekend, a 1-to-1 dose around 10 a.m. And I was feeling floaty about 2 p.m. I can't seem to find my right dose, and drops take 6 to 8 hours to wear off. Turner, you want to try that one?
Yeah, so one thing to be careful with the tincture, they call them sublingual, but you do have to use them sublingually to sort of avoid the oral effect. So, you really want to let those set into your tongue and sort of dissipate in your mouth as much as possible before you swallow them, because the more you swallow, the more of that first pass metabolism, it actually turns into more of an ingestible dosage form than a sublingual dosage form if you just straight out swallow most of the drops. So that would be my first suggestion, is just sort of try to hold them under your tongue as long as possible before you swallow the liquid there, to sort of minimize that ingestible time frame there, that 6 to 8 hour to wear off time frame. But it is tricky to do, and again, I would probably take a look at your terpene profile there to see sort of what you're without knowing what you're trying to treat. I guess with it would be a little hard to make a direct suggestion, but using something that I don't know what the openness to vaporizer or something like that is in that situation, how important it is for it to wear off quickly. But
I think there's one other aspect of this, and that I find important. And that is, when you take a look at the eyedropper, the dropper, there's lines on it. The first line is 5 milliliters, the second one's 10, the third one's 15, the other one's 20. If you're starting out with, let's say 20, you're taking the 1-to-1 and you're starting out with 20, that might be where you're finding your euphoric effect. You might want to drop down to 15, or you might drop down to 10 to find out where your tolerance is to THC.
Yeah.
And then the other option is, once you find where that tolerance is, you can still up the amount of CBD. You won't get high, but that CBD can actually help with inflammation, which in many cases might help you both sleep as well as with the pain relief that you're looking for. Yeah, so the amount is something that you may want to consider.
Yep, exactly.
Yeah, it's there. Let's see now. I was told dispensaries that terpenes can be purchased separately online. Is that true? And can you point me to the right direction if it is? Do you want to take that one? You want me to take that one?
Yeah, sure. So you can absolutely purchase terpenes online. When it comes down to it, please be careful about where you're purchasing them from and what the base of that terpene is. When we work in medical cannabis, we really seek for a cannabis-derived terpene, meaning it's the whole plant's extract that's giving it that flavor. The other option that people really work with a lot is something called a botanical terpene, and there's a lot of great producers of botanical terpenes out there. Technically, perfume is based on terpenes. So there's many different options to find those flavors, but just because somebody is selling them doesn't mean we should participate in them. It's really up to you for where you're going to purchase them if you find a reputable source, because unfortunately
the answer is yes, you can buy them. Be very, very careful when you go to buy them. Just like in medical cannabis, you want a certificate of authentication. You want to do the same thing with your terpenes. There are a lot of terpene vendors that'll tell you that their terpenes are great. Ask them what testing they've done, and also find out if there's any certifications that they have. I think when I was doing the terpene, preparing for the terpene webinar, we looked at fundamentally over 50 different sources of terpenes, and we only found 3 of them that really had the COAs and really had the testing that was done. So be very careful about what's out there. There's like I said, there's just like the CBD market, there was a lot of players, but not a lot of serious contenders that were in there. So you pay attention to that. Right off the top of my head, I don't have any recommendations, but send me an email. Send it to an email to event@marijuanaaware.com, and I'll give you a couple of references on that. Now it says, JR asked, if cannabis makes my insomnia worse, do I quit? Turner, you want to try that one?
Yeah, well, I mean, that's I think going off of his earlier questions there. I mean, if I would suggest trying to find a different combination. Again, higher CBD, look for that CBN, maybe lower the amount of THC. THC can. I have one of our call center manager who I work with closely every day. She has a hard time with a lot of THC revving her up, making her. She has the same sort of issues, and it took her a while to find the right one to work. But she does, she did find one and it did work well for her. So it is just about finding the right combination of product there. Again, it goes back to that individual reaction to the THC. More than likely that THC is what's causing your issue there. So just really sort of focus on the other side, the CBD side, the CBN side, the terpene side. I think you could find something that works well for you. So.
And JR, this is important. This is where journaling is important. Write down what your ratio of CBD to THC is, and also how much you were taking. Find out what the effect is. Then maybe lower the amount of THC or take the dosing and see how that affects you. Maybe increase the amount of. So by being able to play with the ratios. And this is what I love about Move. You can do that without having to buy a product every time. What you're able to do is you're able to try that, use it for, by the way, try it for a day or two, then do every day or two, try a different one, and you'll eventually dial that right in. I wouldn't quit, because you really have something. The fact that it has that effect on you means it's working. What you need to do is you need to find the right amount. And that's where trying it is the best way to go. You're 90% of the way there. Don't quit when you're 90% of the way there.
I can tell you, if you can find something with medical cannabis that can help, that does help with your sleep, it is the most natural sleep aid you can really take, because again, it goes back to that endocannabinoid system, using the natural systems of your body to help you sleep, and you get a much more natural sleep pattern than taking Ambien or benzodiazepines and things like that. So it's worth experimenting with to find the right the right mix, because it is a very good long-term solution, especially for insomnia. So
yeah. Now Mary asked a question in the chat room. What dosing or route consideration should be if you have fat malabsorption issues? I pronounced that incorrectly, Turner.
Malabsorption. And so what was the question again? It was, I got the malabsorption part.
What dosing or route consideration should be if you have fat malabsorption issues?
It's going to be tricky with that. Probably I would say the patches would be a good way to go for her, especially or those liposomal topical products. If she really wanted to try something that was outside of inhaled. I mean, obviously the inhaled piece is going to get around the fat absorption, but I know that's going to be a big challenge for oral dosage forms for sure, because that's going to affect the amount of bioavailability you have with the products. But using it transdermally or topically may be a good option for there, because that bypasses that issue. So
sure. And I think a couple other questions coming in. Matthew asked, is there any dispensaries that charge less for financially challenged individuals? I think don't you have a SNAP program or something with your program, Nick?
I'm not sure if we have a SNAP one here. I know that we do offer a lot of deals in the first-time patient referral cards, where you can get up to either $75 off or 50% off the product, depending on which dosage, which stage you are in the card. Right now, we actually have a promotion running where it's for breast cancer awareness, where we have a stamp program where it starts off at 20% off, it goes off to 25, 30, 35, it ends at 40% off. So each time you stop in, you get a stamp, and then at the end of 5 visits, we actually donate $20 to breast cancer, and you save 40% off of your purchase. So if you've got a card, definitely please do continue using that. But past that, we offer deals quite often, so that's something to keep an eye out for.
I think one of the things that Matthew, you should look at is I sign up for the emails, both for Move and some of the other dispensaries. So almost on a daily basis, there's some incredible deals that come through. I know I just bought a whole bunch of flour. You had a great deal on flour last weekend, Nick. And so, there's a lot of deals that are out there. It's not a matter of just the discounting program. There's a lot of deals that come up. And if you pay attention to them, it's kind of like going for BOGOs at Publix. Pay attention to what's out there, and you'll probably find the products that you need that's out there. Absolutely. It'll help you quite a bit. Anonymous asked a good question. I have a trip coming up to Las Vegas, and I'm flying. Any recommendations on taking medical marijuana? And you guys want to touch that one? Since I just went to Vegas, I'll take that one.
Did you bring anything with you to Vegas, Marc?
Look, let me put it to you this way. Once you enter TSA, once you go through the detectors, you are in federal space. And the TSA people have just come out and said flatly, they're not looking for cannabis. There's no dog sniffing cannabis people that are out there. They're not looking for it. However, if you drop a vape pen in a tray and they see it, they've got to do something. They are required as federal employees to do something to it. So my point is, don't tempt fate.
But yeah, one interesting thing that I ran into or saw happening, we went out to Denver for a conference and was flying back. They were really coming back from Denver. Those guys were really, picking on people pretty bad, I guess, buying stuff in Denver and then trying to take it out. So it may be more of a problem coming back from Las Vegas than it is going to Las Vegas, just because they're more aware of it, and they're giving you a harder time leaving a legal state, coming into a non-legal state. So something else to keep in mind, both ways there for sure.
Yeah, there are a number of very good dispensaries, especially there's a couple of them very close to the airport, for example. That what I would recommend is just go out there and buy a product that's out there and know the product that you want. The rec dispensaries do not understand medical cannabis. They don't understand ratio products. They have not got that formula down. So if you walk in and say, I want one of these, they'll give it to you. And so I'd be prepared to be able to do that. I think that's something to pay attention to. But I would typically go out and I'd buy that there. Do you take a look? And then the other side is there's serious rumors. How do you get it home? I've heard people mail it back. Whether you do that or not, I don't know. Again, you're getting into federal space, not recommending it, but it's something that I've heard does work. But I would just not tempt fate. That's all. I mean, when I go, sometimes we go to Biloxi and my wife and I drive there. I just don't want to get up close and personal with a Alabama highway patrolman. That's all. So it's just one thing to just stay away from that whole area. And they have plenty of dispensaries in Nevada, and also they deliver. I found it amazing that when I went into, I stayed in Mandalay Bay, they actually have delivery people that come in and deliver right to the hotels, which I found very interesting. So
make sure you bring your medical card with you too, just in case there's any sort of discounts, if there's any way that'll help out. So
they say no, and then what they did was they discounted it because I had a medical card. So again, they're not really as it's kind of hit or miss that's out there. So Lee asked a great question. Is there an effective way to naturally thin RSO to use it as a widespread topical, like organic olive oil or coconut oil or something like that?
So I don't have a directive on how to thin the actual syringe RSO there. We only have now the tincture version of the RSO, which is the liquidized version. However, you would not put that onto your arm. You would put it into a drink or into your system directly sublingually. Turner, have you heard of anything pharmacology wise?
I don't. I think you'd have a hard time just due to the molecule size of the stuff in the RSO to get that through topically. Usually, like your topical transdermal products, you would have to emulsify them in some sort of nanoparticle or something there to really be effective transdermally. So I don't think that's going to be an effective option, unfortunately, for that. So.
Yeah, it's the nature of the beast, unfortunately.
Yeah.
Robert asked a question in chat. Says, what about medical marijuana to treat HBP and anxiety-causing side effects of BP drugs? Turner, you want to try that one?
Yeah, sorry, could it on me there? What was that one again?
Said, what about medical marijuana to treat HBP and anxiety-causing side effects from the BP drugs?
Yeah, no, I mean, the anxiety piece of it, absolutely. The one thing to be aware of is THC can, if you're sensitive to it, elevate your heart rate somewhat. So that's something to be aware of. If you have cardiac issues or high blood pressure, shouldn't directly affect it, but it's just something to be aware of. But if the blood pressure is related to the anxiety, it can certainly help alleviate those sorts of things. Again, finding the right ratio will be important. You'd want a more sedating strain, not a stimulating strain, as some types of THC strains can make some anxiety worse. So you just want to be careful with product choice. But yeah, no, it absolutely could certainly help at least the anxiety piece of that. It's not going to have any effect on the blood pressure directly for most people, but secondary to the anxiety relief and those sorts of things can certainly help. So
sure. So listen, we've run through all of our questions. There's one comment that was made I want to make to Deborah. Deborah, you're asking, I'm considering getting a certificate in cannabis patient care. Is it worth it? I'm just going to kind of comment on that if you don't mind. I think that if you're looking at getting into the cannabis business, the answer is yes. If you're looking at it from a usage standpoint, some of those certificates, I know the one from FAU is fairly pricey. It's $3,000. So if you got an extra $3,000 and you're not looking at getting into cannabis business, you might want to take a look at that. But I would only consider that if you're looking at getting in the cannabis business in one way, shape, and form. But I think that anytime you can get educated on cannabis, anytime you can get educated on what's out there, I think it would help quite a bit. You might want to also take a look at Dr. Sulik's healer.com programs. He has some great certification programs. They're a lot less. They're like in the $200, $250 range that you may want to take a look at, and they'll help quite a bit. But I think any cannabis education is worth it. This is my point. So, gentlemen, we have gone through almost 2 hours, and we've gone through a lot of questions. I want to wrap this up. First of all, I want to thank everybody for hanging in there for the whole webinar. But Turner, you got any final comments?
No, again, I appreciate everybody hanging in. A lot of good questions. I really appreciate Nick. He was a great addition to the team here tonight. So, no, really enjoyed it. Appreciate the opportunity.
Cool. Nick, any final comments?
Thank you so much for having me, Marc and Turner. It's invaluable, the information you guys provide and the space that you've created here. So thank you. And Kathy, as long as you decarboxylate the flour before you put it into the tea bag, then yes. But just taking raw flour and throwing it into the tea, no. So what you're going to want to do is I don't know if you guys do any sort of edibles webinars. Would that be something to take a look at for you, Kathy? But otherwise, it's a little bit easier. The tincture drops, those are water soluble, and those will go right into the tea real easy. You don't have to turn on the oven. But thank you so much, guys, for having me and having Move be a part of this, because it means so much to be in this community, and we're glad to be here.
Nick, we did an edibles webinar earlier, and again, if you can go to the website marijuanaaware.com and follow up, you'll be able to see that. The comment about I take a little bit of cannabis each morning, about a pea-sized drop of it, and I drop it in my coffee. And the reason that I do that is because what happens is it releases the CBDA and the THCA, which is the pain and the inflammation relieving properties, but it does not release the THC. In other words, delta 9 doesn't get released. So I'm able to get pain relief and I'm able to get inflammation relief without getting high. And that's just one way of using cannabis. Now, once it's deboxylated means once you've triggered, heated it up to a point where you're triggering the THC and CBD, then that all bets are off on that. But if you take just some regular flower, drop it in your coffee, you'll be amazed at how it helps with pain relief, both CBD and THC. My mother swears by it, by the way. So I just thought even mom's using it. So it's one of the new tricks. But I want to thank everybody for attending. I know it's been a long webinar, and I know there's been a lot of questions that are out there. I'll mention again, we're going to follow up by sending you an email. It'll give you a copy of the video, a copy of the presentation, the resources, and also we'll be listing a lot of the discounts that you get from Move, as well as from My Botanical Wellness. And more importantly, we want to thank everybody for attending. And I'm going to throw a shameless plug in for next week's. Please join us for a pain management webinar. It's next week. Delta 8 is the week after. So if you're interested in those topics, please join us. And again, not only Turner, thank you for your time. Much appreciated. Nick, thank you for your comments. They're excellent. And for Move's participation. One of the people I definitely want to thank is Lee and Deja and our moderators in the background. They may not have their pictures up there, but they've done a lot of job to help us. They're the ones that really make this whole thing work. And I want to thank everybody for attending. We really appreciate it. Without you, this wouldn't be happening. And more importantly, we want to help you be able to get your life back, and let us know how we can do that. Again, thank you, everybody, and have a good evening.
Thank you.
Thank you, everyone. Have a great night.